you have a busy day today, Natalia?
Not really. I have about 4 people after this that I see.
How long does it take for every patient? It's like 1 hour per 1 hour.
Yeah, pretty much.
Yeah.
Oh, Gabrielle says we're live. Okay.
Yeah.
Because I'm getting a window that says live stream is not available right now. So we're live. We're streaming. Everybody, if you're here, please write in the comments. Let us know that you can hear us. You can see us. Hello, Alex. Hello, Rachel. Thank you so much for coming along. Okay. Make sure Dr. C and Dr. Capitán. Live stream is not available right now, so we're live. That's me. That's my problem. I've silenced it. Our tabs are on silent. Our phones are on silent.
Yep.
Very good. Okay. Olive, thank you for coming. Senna, tell us where you're from. What countries? What countries are you from? Last week in the live stream, I had people from all over the place. Australia, different places in the US, Canada, South America, all over different countries in Europe. It was amazing.
You're becoming very famous, Lilia.
No.
Worldwide. That's very good.
I don't know about that. Okay, so we've got 1 more minute to go. Just let people come in. And I'm just going to open up here.
You have to do a lot of management there with comments.
Yeah, that's why I have Gabriel helping. He'll be passing me some of the questions in case there are a lot of questions. And I can't keep up with both the questions and the conversation sometimes, so we won't miss anybody's. All right.
Is 11 o'clock there, Natalia?
It is exactly 11 o'clock right now.
LA, right?
Yep. Los Angeles, California.
Wow. It sounds very cool. I don't know. It sounds, but
it sounds really good, or my accent sounds good.
Everything sounds good.
It's probably the accent. I think right now in the middle of pandemic, anytime we connect with people, even if it's virtually, it feels really good. Just to see somebody else's face other than your partners or your family.
It's true. It's true.
Okay, so it's 8 o'clock, so let's get going. Hello, planet Earth. Welcome to Lilia's Weekly Wednesdays. Thank you again for joining us as we open our 3rd event in Pride Month. Happy Pride. Who am I? I'm Lilia, and my pronouns are she and hers, and I'm the creator of a 3,000 strong Facebook peer group, which I founded 8 years ago this spring. And I have always been dedicated to the trans community since 2008. And that has made me always feel like an advocate, a patient advocate. And I'm keenly aware that researching gender identity services nowadays is overwhelming. So that's why I decided to do some of these live streams with other healthcare providers in the trans sector. These live streams are a way to communicate important info to you, our followers, and they provide a beacon so that your questions regarding transition may be answered in a transparent fashion. So I'm very proud today here to have and honored 2 experts as usual from 2 different continents, North America and Europe. We have Dr. Natalia C., PhD of California. Thank you.
Hi, nice to be here.
And Dr. Luis Capitán, a facial team in Spain.
Hello, really nice to be here.
So to all of you who are here now, or if you've come back and you're listening to the replay, please let us know where you're from. So we can do a shout out and let us know in the comments below what your doubts are so we can include them in our discussion today. And if it's the replay, then we'll get back to you by email. So now let me introduce our special guest, Dr. Z, Natalia Zikareva. Did I pronounce that right?
Yes, you did. Very well.
Also known as Dr. Z, PhD, is a clinical psychologist specializing in gender issues and transgender care. She strives to shift current paradigms of gender by writing and speaking weekly on her transgender and non-binary blog and the Dr. Z PhD YouTube channel, which is amazing. So she's known for her very direct, clear voice, which is why I love her personally, and is often featured as an educator at the Los Angeles County Psychological Association and the Center for Healthy Sex, and as an advocate on podcasts and interviews just like this one. Please check out her website, drzphd.com. So now you just keep pumping out those blogs, Dr. Z, with those big questions. Boom. Boom.
I love writing about this topic. This is my passion. This is what I dedicating my life to. And I can't imagine doing anything else. And I really, really enjoy it, especially enjoy my YouTube channel, interacting with everybody who's commenting on it.
I have to commend you also for being there for people in the trans community that nowadays find it very difficult to get those authorization letters, which you happen to do for free, which is incredible.
As long as you're a resident of California, I do all of the evaluations for any kind of gender-related surgical procedures completely for free. You just have to be a resident of California. Unfortunately, that's the licensure rules.
That's fantastic.
That's very, very nice from, yeah, it's amazing. Yep.
Giving back to the community in any way we can. So also now I'd like to introduce Dr. Capitán. For those new to Facial Team, Dr. Capitán and his colleague, co-founder Dr. Daniel Simon, began Facial Team in 2010 in Marbella, Spain. A decade later, their team has grown to a group of integrated professionals. Now we're at 50 professionals, I believe, with surgeons, dermatologists, nurses, psychologists, and coordinators, all dedicated to facial gender surgery patients. And under Dr. Capitán's direction, Facial Team's achievements include over 3,000 feminization surgical procedures performed, and with 8,000 patients who have benefited from our free consultations and orientations on 4 different continents in the last decade. He also forms part of the research and development of Facial Team with award-winning research that includes 18 published scientific articles in leading journals, and is the founder of one of the first FFS training programs, which was launched 2 years ago in 2018 to train future FFS specialists, which is done in conjunction with leading medical institutions such as the Johns Hopkins University, Mount Sinai, and the American Society of Plastic Surgery, their annual meeting. On top of this and many technical innovations under Dr. Capitán's leadership, Facial Team is also active in raising the visibility of transgender and non-conforming surgeries. He's on the surgical work group for the revision of the 8th edition of the World Professional Association of Trans Health, which is known as the Standards of Care, SOC. And it's like the equivalent of the best practices of the World Health Organization, but in the trans health sector. And it's the document which informs the worldwide trans health sector health provider network all over the world, and is currently the principal reference in the trans non-binary intersex healthcare, which insurance companies use as their guide. So it's a very important document, and Dr. Capitán is helping to get FFS on the map with the next revision. So boom for you too, Dr. Capitán.
Thank you, Lilia. I mean, it sounds too much, but it's not. I mean, we are a group of people. I think it's more similar to a family. We have been doing this for several years. We have been learning, and we keep doing what we really love to do, surgery for the transgender community, and it's something that hopefully we will keep in doing. I hope for many years. So at the end of the day, all what you said is the final result of a day after day, working with the community for more than 10 years. So yeah, but thank you.
That's right. When I started working with you 12 years ago, actually.
Correct.
And on Monday, the 16th of June, we celebrated 10 years as facial team. So it's a special week in Pride Month for us. So I'm the host for our discussion today, and I'll be switching the screens, focusing on who happens to be talking in that particular moment. I've been authorized to interrupt. I'm not being rude. For you who are viewing now, please remember to send your comments here down below, and we'll be trying to address those as we're talking today, okay? Our hot topics include today the reality of dysphoria of our non-binary, intersex, and other gender non-conforming patients, with a highlight on expectations and being prepared for facial feminization surgery. So as a little icebreaker, because of everything that's been happening in the world and these last couple of weeks, it's been a bit hectic. And with Pride Month and things that are happening in the UK with the repeals of legislation, and in the US, both positive and negative. J.K. Rowling out there causing a hubbub. And we just wanted to make a mention of this, because we know that it's all very dear to your hearts. So Natalia, do you have a message you'd like to send out about what's happening in the world right now and
what isn't happening? Because there's a lot of happening, right? We have the big pandemic, which is especially affecting trans community, and especially since today we're talking about surgeries, right? What's happening is that a lot of individuals' surgeries are being put on hold. So as a result, your expectations and your desires are being put on hold. And as we know, a lot of these people have been waiting a long time to get the surgeries. And so, a lot of people are struggling right now because of that. On top of that, we do have some good news. We have the Supreme Court that just passed that ruling, which I think was really fundamental and huge, and in a way acknowledges gender beyond just binary. While they haven't really explicitly said that, I think we're starting to roll a little bit in that direction. I think that's a very, very big win for gender diverse community.
Absolutely. I'd just like to share a link, actually, because somebody's asking who is J.K. Rowling, and we'll be sharing the link in the comments below. There's a really good essay about the things that she said and why it's really hurtful to the trans community. And Katie Montgomery is the author. We happen to know her, and she's dissected the argument very well. And it's sad. It's sad, to be honest. So yeah, for those who are interested in learning a little bit more about that, and the link will be shared here in the comments.
Lilia,
what's your
thank you for this icebreaker. The thing is that this is a very unique platform for giving a message of, first, love, and second, total support. I mean, at the end of the day, we have to express clearly with our voice and with our facts what we do. And we work for the community, and we work with the community. So we have to be sometimes their voices. Is what we do, is what we live for, what at the end of the day counts. So message of support, pride, and love. This is what.
Absolutely. And there are healthcare workers like ourselves that are behind the community, supporting the community. And I encourage, if any healthcare providers are watching now, please do contact your MPs, contact your legislators, and show your support to of the community so that their human rights are respected. So moving on to, Dr. Z has a very good, timely blog post that she wrote about some popular transgender myths. Four of the most popular transgender myths are debunked by her in this post, and I think it's very timely for her to publish it now, because it clears up some of the air, and We'll share that link as well here so people can read that later on. But what I would like to talk about today is more about the psychology, involved in gender transition and in its relation with facial feminization surgery, or any surgeries for that matter. So I'd like both of your opinions on what does a gender therapist and an FF surgeon involved in gender transition, what do you say about post-op depression to FFS patients? How do you see counseling helps around the time of gender surgeries?
Well, Dr. Capitán, if you don't mind, I'll start since it's a little bit closer to psychological forte. Therapy going through transition is incredibly important because as you transition, you're going to run into obstacles. You're going to run into obstacles in relationship to yourself, in relationship to the world, in relationship to your loved ones. And as a result, it is really important for you to work on issues that may come up. A lot of individuals usually when they start transition, they're not aware that they have a lot of internalized transphobia. In fact, I think pretty much majority of people living in US, one way or another, have internalized transphobia because the world is pretty much a very transphobic place. So it's really important to work through those issues, especially when it comes to surgical transition. As we know, surgical transition is one of the biggest steps in transition because that's the time when you're getting ready to kind of go through those actual physical changes via surgery. And surgery, just in general, a big step for anybody. Anybody who ever had any surgeries knows that usually after the surgery, most likely you will be hit with depression because it takes a toll on your body, it takes a toll on your psychology. You're going to be at home, you won't be able to move depending on the surgery, you won't be feeling well. There's all these elements going together. And especially for transgender community, when you're going through any kind of surgery, and today specifically, we're discussing facial feminization surgery, you're going to be hit with post-surgical depression. I rarely see people who don't really have any kind of depression following the surgery, just that common. Because especially for facial feminization, you have all of these expectations, you have all these desires and wishes, how you're going to come out. And as Dr. Capitán, you know, once you have FFS, you're incredibly swollen, you're bandaged up, you don't look the best. And coming out of surgery and having that being the first image that you confront can be quite depressing. It can crush a lot of your hopes. It can immediately crush a lot of your ideas of how you expect it to look, how you expect it to feel. On top of that, there's pain management. There's a lot of other things that you're incapable of doing. So it's a difficult process for a lot of people. And after the bandages come off and the swelling comes off, which also takes a while to settle, to see the full results of facial feminization surgery, a lot of times what happens is this confrontation with your new self, right? This confrontation with your new face, with your new identity. So there's a lot of things going on there that really cause depression post-surgery.
To me, Lilia and Natalia, there are three main aspects that for this post-depression, post-FFS. Aspect number one is the physical aspect, like Natalia said. So after a very significant trauma to the face, because the surgery at the end of the day is something very traumatic for the face, patients, they are swollen, patients, they are bruised, they are sore, they are with bandage around, drains coming out of the head. I mean, this is something very aggressive. So this is a clear consequence for the depression is a clear consequence of this physical phenomenon. Aspect number two, psychological point of view. Patients after the surgery, they look to the mirror, they see this not very good aspect. They start thinking, oh my God, what is going to happen? Oh my God, this is gonna be okay. Am I going to get the outcome I was expecting for? This is not very well. So aspect two, psychological. Aspect number three, sometimes because of the anesthesia, because of the drugs you received during the surgery, that, hormonal variations because of the surgery, this is the third impact for depression. So, but what we have learned in all these years is that as Natalia said, a very good preoperative preparation from a psychological point of view is extremely important. The better prepared you are before the surgery, the better you will face the post-op. So depression is something very likely to appear. We have very well identified the aspects or the keys for this depression, and it's important to be ready for this. So
right, and I would even dare to say that the psychological component, the second component that you named, is probably even a bigger component, because there's so much tied into that apart from expectation. There's big part of passability for trans women, a desire to pass, a desire to look particular way. And I think while physical changes that hit you, the physical, the swellings, the bruisings, the trauma that you get on your face eventually do go away, right? The psychological really highly tied to how prepared you are. And whether you're working with a therapist or you're doing some kind of inner individual work, I think it's really, really important to kind of go inwards and to outline for yourself, what are you expecting to get out of the surgery? What are the potential outcome? And then I always tell individuals, take your expectations and then drop them down a little bit. And if you're going to hit those expectations, that's fantastic. But in the very least, by dropping them a little bit, you realistically adjusting, you gauging the reality of what's about to happen to you.
Natalia, because we know how much important the psychological aspect is, we decided to incorporate a psychological department in our daily routine. And now we are introducing this psychological support in the very first days after the surgery. Do you consider this is a good, something good to do, a good idea, or do you think it's better to wait a long period after the surgery? What do you think about this?
I think absolutely. If you're able to do it, if your team, if your department, if your clinic is able to do that, I think that's brilliant. I think that's incredibly, incredibly important, because as we know, a lot of times surgeons they're surgeons, they're incredibly trained, they're skilled, they're very good working on individual body parts, but they're not often very well trained to be people per se, or talking to people about what they're feeling. It's just not their forte, and understandably so. So I think it's really, really important to have somebody, a person can talk to immediately following the surgery. Hopefully, if there isn't a therapist to be introduced, people are traveling or people are getting surgeries with somebody who's accompanying them for support. Maybe it's a loved one or maybe it's a close friend, but having somebody there, whether it's a therapist or somebody else, is really, really important immediately post-op.
Yeah, we are in the same line, and this is something we are implementing. So it seems that we are in the good.
And we also have the patient coordinators. So it's the professional, is the psychologist that attends to both the patients and their family members and companions that come with them, as well as the patient coordinator who's in 24-hour contact with the patient, who's not a psychologist, but is there to provide somewhat of moral support, especially for those perhaps who come on their own. So let's go to the 5 topics on transition from the experts' point of view. We have 2 experts here. And I'd like to start with the dangers of social media, which Dr. Z also has a blog post on. Would you like to start, Dr. Z, on what are your key dangers?
Right, and I'm gonna be mindful to tie them to today's discussion about FFS in particular. Today, especially more than ever, there's so many social media platforms, right? From Instagram to Reddit to YouTube, on which we are today. And as a result, there's a lot of people out there discussing and sharing their experiences, which is phenomenal because it makes everybody connected. Now, the dangers of that is that sometimes people don't realize that what others are sharing is just that, their soul experience. And their soul experience is only very specific and very centric to what they actually went through. So it's going to be very specific. And a lot of times I see a lot of my clients tend to do that, is that they'll watch social media, watch a lot of younger individuals talking about going through FFS and getting this amazing drastic results. And they develop what I call magical thinking or wishful thinking, where they suddenly think that that's exactly how FFS is going to be for them. That's the end result they're going to get. Well, the reality is that that's really not the case. Each individual case is very different. And as Dr. Capitán will say, each individual's face is very different. I did, as you, Lilia, know, I did a video talking about FFS, what it will not and will not do, trying to educate people that FFS is basically taking your face that you already have with a bone structure that's already set in place and feminizing it as much as possible. What FFS is not intended to do, it's not intended to give you a cisgendered female face. That's just not what it's going to do. So yes, there's some people that have incredible results depending on how androgynous they are to begin with. Also depending whether it's somebody who's younger and maybe was on puberty blockers and puberty hasn't really kicked in. So there isn't those results of testosterone. But for a lot of individuals who have been through puberty and underwent puberty, and especially older, it's just not going to happen like that. And so I think it's really important to, again, we're going back to expectations, to keep realistic set of things in mind, because it's just not going to happen like that. You can't go, I can't physically go into surgery and come out looking like Cher. I just probably don't even have bone structure to mimic Cher's bone structure. So for somebody who's already has a masculine bone structure, that's just not going to happen. So really, really important when we're watching social media, we have to keep in mind, we have to have a critical mind and ask ourselves, who is putting out these videos, right? And the reality is that it's usually young individuals who had very successful transition and they're eager to talk about it. We rarely see people who had a very realistic transition talking about it. And most importantly, we almost never see older population talking about it.
Absolutely. Dr. Capitán, there's a question for you from one of our viewers on the topic of expectations and virtual FFS. Alex asks, hang on, let me just pull it up. Does Dr. Capitán feel virtual FFS, which is a digital simulation for those who don't know, match surgery results? And how does it help clarify patient expectations?
Thank you, Alex. Is a very, very, very good question. And I would say, yes, it does. But let me clarify, okay? Virtual FFS is a really powerful tool for the education of the patient. So the patient can learn how the surgery will affect their outcome. So of course, it's a very good tool for adjusting the expectations. So sometimes people, they see a very different outcome to the real one. So let's say it levels the expectations, because you can see, I would say that in a 80 to 90%, which is a really high percentage, how the result will be after the surgery. But very important, is essential to have a very good provider of virtual FFS. I mean, is not only playing, it's not only drawing in the computer, this is the outcome I desire. No, it's something more complex. You need to understand the surgery. You need to understand the structure. You need to understand how, by changing the structure, the soft tissues will change and the features will readdress. And this is not something not easy. So it's a very good educational tool. It's a very good tool, for understanding the expectation and adjusting the expectations. So I would say absolutely yes.
We've just put a link down in the comments to a post that we've written on the topic of virtual FFS, and it explains very quickly the way that it helps and adjust expectations, if any of you would like to read more. And we also have another link. We have another link that we'll share again.
I forgot to mention that it's important also to understand that virtual FFS, normally it works with a two-dimension picture. Okay, so you can see your before and after, your virtual before and after in 2 dimensions. we have to remember that the face is something really dynamic. So we express a lot of emotions, a lot of interaction with our muscles, with our mimic. And the mimic is something that the virtual sometimes cannot represent. So this is also something to bear in mind. Okay. So, sorry, I was just want to clarify this.
No, that's important. And I'd also like to mention that we have been working with an expert in the field, a facial gender analyst. Her name is Alexandra Hamer, and she has a website called virtualffs.co.uk. And she's also been working for decades analyzing the facial features and observing actual surgery and working alongside our surgeons in hundreds of consultations. So she really does have a very in-depth understanding of the ramifications of the surgery and the outcomes. So we get asked a lot about this question, actually, and they're on the topic of expectations. It's an incredible tool, not only to help adjust expectations, but also I always tell our patients that come to see us in our international orientations that it's also an amazing tool to share with friends and family who are your support network, because they're often very fearful of, you know, what's going to happen to your face and how are you going to look? Are they going to be able to recognize you? Are you going to be a completely different person? And it's not like that at all. And the virtuals simulations, which Alexandra Hamer does, show that how different procedures affect your face, and they're not going to create a Barbie doll. And it's also good to show a combination, the different combinations of procedures, and how and it helps a lot with the surgeons also to determine alongside with the patient which procedures are going to have the biggest impact and which are going to have a marginal impact, so they can better decide what the surgical plan is going to be. Is that right, Dr. Capitán?
Absolutely right. And now that you mentioned Alexandra, I know her for a long time, years, and she's something unbelievable to me. She's a real virtual surgeon, much better than many other surgeons I know. I mean, something unbelievable. The ability she has to obtain a very predictable outcome virtually talking. So she really understands how the structure can be modified, how subtle the change is going to be, but with this subtle change, how drastically we can change the gender parameter. So it can go with a very subtle surgical change from something masculine to something really feminine. This is something very subtle that she has. She's like a real artist. And it's a good idea, Lilia, for those people who is watching us to take a look to Alexandra's website, because she has a lot of very nice information, very, very important information to understand better what the facial gender markers are, what they are, and how they can be changed, the importance of the of the measurements, balance between the facial thirds. It's something technical but very interesting.
Yeah, I was gonna say, listening to you talk, I wish there was almost a requirement, right, to do a virtual, because talk about holding a blueprint, potential blueprint of what FFS can do for you before you go into it. Talk about having actually something tangible to look at for you to go over your own inner desires and expectations. So I think it's really, really important for people to have and to do. And talking about Alexandra and her work, I have a question for you, Dr. Capitán, in terms of, and this is something that a lot of my clients actually ask me, whether they should go with a desire of how they envision themselves as a female, or whether they should trust a plastic surgeon with the symmetry and anatomy of the face. And I have a lot of people asking that, because there's this fear, what if my plastic surgeon's subjective beauty, subjective perception of what's beautiful and what's female is not really how I want to be seen? That's
a very difficult question, Natalia. I mean, the line the line between aesthetics or aesthetics proportions or aesthetics outcomes and a structure sometimes very, is not really clear. I mean, we always try to be very objective, okay? And we try to make a very critic analysis of the face, okay? And I'm gonna ask with a picture. I mean, this is something really, really, really objective, okay? And now we have learned that many of the principal gender markers, 90%, they are here. And this is something that is not subjective. It doesn't lead to misinterpretation. It is what it is. So, and this is something really key for us. I mean, otherwise you are mixing aesthetic components, kind of artistry. I mean, you can be more or less artist, but at the end of the day, we are technical people with a lot of hours flying in the plane, It's like and this is to me, is a fact.
Right, but would you agree that there's two components? I'm sure there's more than two, but I'm being very reductionistic for the sake of discussion. Two components to facial feminization, in a sense that there's a first component working and feminizing as much as possible the bone structure, right? To anatomically mimic and soften those features to mirror a female bone structure, right? So that's the first component, the bone structure. And then the second component is a soft tissue addition component that further feminizes cheek implants, lip fillers, things like that. And that's where I think that maybe subjective aesthetics of plastic surgery happen.
Natalia, I tend to agree with you, okay? But these two components, I mean, to me, they are totally different. I'm going to give you an example. For any cis women, it is also important to have very good round cheeks or better full lips. I mean, so, and this is something, again, subjective. But if you have a very square chin, or you have a very visible Adam's apple, or you have a very protruded ridge, this is something absolutely objective.
Sure.
So
the first component
to me is basic.
Agree.
Because then I could also say the role of HRT, how the HRT is going to soften the skin, how important the hair removal treatment is in terms of laser, electrolysis, whatever, but how important is for the patient to treat the hair, how important the fat distribution is. And this is something you are not going to get with the surgery. And if you think you will, probably you are wrong.
Right. No, I agree. I agree that the first component working with the bone structure is absolutely objective. That's pretty much all symmetry and anatomy, pretty much. The second component is, I think, a little bit more subjective, because there are a lot of plastic surgeons and there's a lot of clients who go to one plastic surgeon recommending large size cheek implants, and another one will recommend a smaller. So, there's two completely different suggestions. And a lot of time patients have a difficult time deciding which surgeon do I trust. I trust the one that says bigger cheek implants versus somebody who, and I think that's the aesthetics of subjects.
But Natalia, I think this is interesting. I mean, probably nobody told this patient that if they change the protrusion of the forehead, because it needs a very important, significant setback, and they change the volume and the size of the chin, automatically the cheeks will look bigger. Is it important? It isn't. It is very important.
I'm glad you say that.
I very rarely indicate cheek implants because I do not consider it's a key component of the gender identity of the patient. Because I know hundreds of cis women with totally flat cheeks. Is that a gender component? Is a gender marker?
I think I'm really, really glad you distinguish. And you clarified, because I think we're now stepping into the zone of trained plastic surgeons, right? And I think we're talking about the difference between just a plastic surgeon and the difference between a plastic surgeon that is craniofacially, maxillofacially certified and trained, right? So we're talking about those two very, very big components. And I think perhaps the individuals who just fall into plastic surgery category, who are so used to working only on a soft tissue on a face, right? Who also do facial feminization surgery, although I don't think they should be doing facial feminization surgery, because as you know, it's a very specific subset of surgery requiring its own training. As a result, I think those are individuals who try to mimic the surface structure of the face anatomically, with the bigger cheekbones and the lip injections and so on and so forth. Whereas individuals like yourself, who are highly trained in transgender surgery, are working more with those objective bone structures underneath the face.
Natalia, it's important. I mean, I'm not saying that cosmetic is not important, but I strongly say that it cannot be level to the same, to the same step than structural feminization. It should not. And this is something that we are working very hardly to change in the new standard of care. And this is one of the reasons facial feminization has been always like in a gray area, belonging to nobody, because it's something aesthetic, it's something structural. It could be, no, it's nothing aesthetic. It's gender markers conditioned by the craniofacial structure. And we are going to this, I mean, when we reach this point, everything will change, because then I think it's gonna be really clear to me.
Can I say something here? There's a couple of comments here on this topic. Actually, Olive has mentioned, on the topic of expectations, and that she guided her procedures by looking at her sister and her mother's face, and use that as a way of deciding how she wanted to look. She wanted to look like her sister and her mother, and all the feminine version of herself. But she does say that her sister is, now that she's had FFS, it seems, and they're envious of her results. they want the fuller cheeks. You see that a lot, I'm sure both of you, patients who want to, and this topic of over feminization. No, this is a thing. No, that because it's about erasing everything and exaggerating the femininity in order to compensate maybe for other factors. What is your response to that?
That question was for me, Lilia, or was for
both of you? For both of you, really. It's a difficult one. Because it's going into maybe the next topic we had planned is the problem of magical thinking.
Yeah, it's magical thinking, and you said, and it's a very important topic to discuss, the hyperfemininity. I mean, are we looking for hyperfeminine results, or are we looking to obtain a soft, natural, and feminine outcome? And this is what we should aim for. I mean, this is at least my point of view. I mean, full, rounded, big cheeks area or implants or whatever is important. Probably it is, but it's not the key to be read as a woman. I mean, because sometimes you can cross this line of exaggeration, of artificiality. I mean, and we are totally running away from artificiality. We are totally running away from plastic outcome. So to me, I mean, and I know I'm very, very tough. I'm very rude sometimes, but I prefer to be. I mean, because to me the line is really clear. And I always tell my patient, I mean, I'm not here selling a treatment. I'm not here selling procedures. I'm here giving you an advice, and I'm going to identify those gender markers that makes your face look masculine, and how by means of surgery we can address this. After this, if you want to be more feminine, more beautiful, more hyper feminine, you can go for different procedures. Probably not with us, but to me the line, it has to be very clear.
Yeah,
I'd like to ask, sorry, you have, go ahead.
You sure?
Yeah, go ahead.
This is one of the reasons why I love you guys and what you do over there in fascial team is that you're very mindful and conscientious about natural aesthetic. And what I see generally is that patients who have really worked on also their internal self and not just external self are more likely to go after natural aesthetic. And the primary reason is because they were able to work and define and understand what is their inner femininity. And I always tell patients, you have to find your own femininity. You cannot look out there for the standards of what feminine is, because the feminine out there in the world is deeply exaggerated. It's not it's not your normal everyday majority of the feminine. And so you really have to work on identifying what kind of woman you are. You can't just be constantly mimicking and chasing that imaginary ideal, hyperfemininity as you called, and Lilia, as you said overly feminization, all of the things. And again, the more you work on your insights and the more you get in touch with who you are as a female and get in touch with what that female for you represents, the more likely you are going to have those realistic, natural looking set of results versus chasing the type of, hyper cheekbones. And, we all know what the person looks like when they come out and they actually look like they had a lot of plastic surgery versus no plastic surgery at all.
Absolutely. And it's what I was going to say, Dr. Z, is that the idea that FFS can solve all the problems is part of that magical thinking, isn't it? And you have a post about the two main reasons why a surgical transition alone won't make you happy. There's a lot of other things happening. Do you want to mention what these two main reasons are?
Absolutely. So surgery is really important. And I truly, truly believe that FFS, specifically for trans women, can be a game changer. Absolutely. I think it's a really, really important component of transition for a lot of trans women. So I don't want to take that away. What I do think is dangerous is that at some point we start chasing the body. We start chasing the idea of external, the idea of how we're seen and how we're perceived. And that's again stems from not being able to integrate your internal sense of identity. As a result, what happens is that because you're so hyper-focused on external and how the world sees you, you're hyper-focused on passability. So you become incredibly anxious. You become very paranoid every time you go out there because you're expecting and you're waiting for the world to validate who you are. The world shouldn't be able to validate who you are. You should be able to give yourself that validation. And then once you get that validation and acceptance of who you are, it would be also fantastic if once you go out there, the world mirrors back how you see yourself. But it shouldn't come the other way around. And I think that's one of the biggest components, that's one of the biggest dangers, is that we start chasing this body. And at some point, the gender dysphoria stops and it gets into body dysphoria. And when it gets into body dysphoria, there's no endpoint because nothing is perfect at that point. And we're just constantly, it's like going down the rabbit hole. And it's very dangerous. And I've seen individuals who ended up having way too much plastic and reconstructive surgery as a result of it. And sadly, instead of passing and being validated in the world, they're getting the opposite. Now they're not passing because they have so much surgery. And the world out there doesn't know how to place them. It's almost like this overly too hyper-surgical feminine.
Natalia, I have a question for you. Would you say that within the FFS spectrum, the FFS group of patients, we have like two groups? Those patients that they are looking surgery for themselves, for their same self-esteem, and for a better quality of life, whatever, and another group looking surgery for the rest of the world. For how people are gonna treat or read them. Would you make this distinction, or do you think this is not something that is not real?
It's a bit reductionistic. I would say there's probably more than two categories. There's also a third category of a person in between, the one who is looking for that confidence, that self-assurance, to feel good about themselves, and also wanting to be validated in the world. So I think there's a lot of things on the table when people go through FFS, and certainly sometimes people do fall into one of these three groups for sure. In the end, I think it all has to happen internally. Gender identity is a part of your core central psychic sense of who you are as an individual. It is something that first and foremost has to be reconciled on the inside. Now, of course, with gender, the challenge is that your desired true gender doesn't match your biological sex. So the reconciliation also has to happen on the outside with the help of the transition and especially with the help of surgery. This is why people feel so much more confident and better and more assured once they have FFS. But the process, I would say it's percentage-wise, it's more bearing on the internal. You have to accept who you are. If you haven't accepted that you're a transgender person, and it doesn't really matter whether you're going to be out there advocating for yourself or being very vocal and transparent about being transgender, that's personal, that's up to you. But you have to accept that on some level, you are struggling with gender dysphoria. And with that acceptance becomes acceptance of how now you're going to integrate the part. And FFS is a huge part of that because it gives you that confidence. It makes you finally see yourself in a mirror. It's a very big component.
It's self-validation, absolutely. And you have a post on it, which is very interesting, actually, Dr. C. The dysphoria and body dysmorphia and rushing into the transition. I've seen over the course of the decade, a lot of patients. I want to have FFS this month. And do you have a date next week? Hold your horses. And it's understandable that, once they get to the point and they're ready, they want to do everything at once. But
this is interesting, Lilia. This is something we repeat in every single consultation. I mean, take your time. It's an extremely important decision. I always say the same. There is one phase, so it means one shot. So there is like no 2, 3, 4 different opportunities. Because if you have a bad result and complication, this can be turned into a mess. And this is something we sadly observe very frequently. So it's important that people understand, patients understand, the better informed they are, the more information they have, the better prepared they will be to make a decision. So I do not expect for any of my patients to have surgery done in at least 8 months, 1 year after the first consultation. Something different to this. Of course, the patient can be very well prepared and it can be like in 4 or 5 months, but the average, at least 6 months and more.
Yeah, that's a challenge. We live in a culture where we want everything now. We want everything really fast. And I observed that especially in California, because we have a state-funded insurance that covers every single transgender procedure. And as a result, a lot of people who haven't had accessibility to surgeries before, because due to their financial status, are now have that accessibility. So I do understand, because I do 5 to 7 evaluations a week. That's 5 to 7 people on a daily basis. And I've done probably over 400 evaluations of people wanting to get different types of surgeries. And that just tells you how many people are out there are eager to modify their body, are eager to get that congruency that they seek so they can move on and live their lives. So that eagerness is very expected, right? At the same time, there's a careful line about not only educating, but also talking to individuals about and doing research, frankly, into their surgeons and what their surgical experience is. Because like you said, it can be really kind of lethal in a way. I mean, I've heard cases of people going into FFS and then having pretty much a nervous breakdown because the results were not only what they were expecting, but let's just say they were a botched surgical research, so to speak. So it's really, really important. It's really important to take your time, but we also live in a world where people don't want to take a time. And so I have to respect people's autonomy and people's right to their bodies. And I, more than anybody else, I really, really know what it's like to live with gender dysphoria, especially for trans women. For trans guy, testosterone does amazing things to the face. For trans women, you know, estrogen just doesn't, I mean, yes, it does, it helps a lot, but as you know, that bone structure, it's not going to go away on hormones. And so for trans women, it's very difficult as they start socially transitioning. Face is so vocal, it's right there for the world to see. That's the first thing that people see, following the voice. So it's incredibly important. So it's like a fine line, you know, how do you put a brakes on this eagerness that is so natural and normal? And at the same time, how do you play the safe game where people can get the best results possible?
Natalia, it's true, and I mean, I really agree. I mean, this demand of immediate result, of something very quick. I mean, I'm asking, is one of the reasons why the psychotherapy support is so important during the whole process. I mean, to give an adequate answer and to make the patient really understand how the times and how the steps needs to be really, you know, in consonance. And do you think this is one of the key of the psychotherapy support during the process?
Absolutely. I mean, psychotherapy is important, period, right? And it is definitely one of the biggest components about psychotherapy is to talk about and, you know, drag yourself back from this kind of quick, immediate now, because the body can be really quick to change. But if your psychology, your mind hasn't caught up, that can be a dangerous game. Your mind has also catch up to what's happening to you. Again, anybody who had any kind of surgery, transgender or otherwise, any big surgery knows. I had a big surgery on my leg, so I know once you get out of the surgery, your mind has to catch up to what's happening. Now imagine when you come out and your whole body completely changed. So the psychotherapy is very important component, but also can't force people into psychotherapy, right? So psychotherapy is not something that's accessible or affordable for a lot of people. So that's the challenge. I think there's a lot of players on a table between people being very eager, desiring to change right now, the politics involved, people wanting to get surgeries now while insurances are covering some of these procedures before, God knows, you know, different administrations have different policies. They sometimes scale back, they change them. So there's a lot of fear here for a lot of individuals on a plate to get these surgeries as fast as possible. I wish everybody was in therapy with somebody, at least for some period of time, hopefully before and hopefully after any of the surgeries. But the reality is that just doesn't happen. And people just have to make decisions and move on their lives, and they just do it very quickly.
Absolutely. On that topic, for anybody watching who'd like to hear a little bit more on this specific aspect, Dr. Z has a blog post, which I posted in the comments below, 3 major mistakes that trans women make when transitioning. There's a couple of comments here that I'd like to bring up to both of you. From Alex, who says, many of us, Francesca, she says, many of us really don't care what anyone else thinks about us, but we hate seeing ourselves in photographs and in the mirror and avoid using mirrors at all costs. So it was going to what you were talking about before, in regards to the reasons why people have FFS now. And there's lots of different reasons why. And another comment here is about a dermatology. Alex here in the comments says, consider dermatology, says that many procedures used in facial surgery were invented that come from the field of dermatology. Dr. Capitán, do you have something to comment on that?
Could Alex be more specific? I mean, is she referring to any specific procedure, or I mean, to me, it's clear from where the craniofacial procedures come from, and is a let's say it's a mix of craniofacial surgery, maxillofacial surgery, plastic surgery, ENT, and probably dermatology, but is kind of a mixture. So remember that the forehead reconstruction was first described by Douglas Osterhout in '87. So it's really recent. So, but I'm not really aware of this origin in dermatology. I'm sorry.
Not no problem. You don't have to know everything. It's okay. Another question here for you, Dr. Capitán. Alex is asking, does facial team have a threshold or a cutoff for patients with unrealistic expectations or indications of dysmorphia to prevent them from going down that rabbit hole chasing something unattainable?
Yeah, and this is a very good question. During all of our communication with the patient, we try to identify those unrealistic expectations, and there are, like Natalia described in one of her video blog, the red flags, correct? So there are clear red flags where you can identify a very unrealistic expectation, or where the outcomes, they are not going to satisfy the patient. If you detect, and it's important trying to detect, and of course you can fail, but if you detect that the patient will never be happy whatever you do, of course you don't go to surgery. And I have rejected a lot of procedures to be done because I know it would be a clear mistake from my side. So detecting the expectation is extremely important. Yeah.
Okay.
If you don't mind, that I know that a lot of people that I work with would be curious to know answer to. Do you, Dr. Capitán, do you guys have a requirement for facial hair removal prior to the FFS? And if so, do you have a preferred method of hair removal, laser versus electrolysis?
Again, a nice question. I mean, normally for HRT, I would say yes, we clearly ask to our patient to be treated previously to the surgery, okay? With the facial hair removal, is different because there are different factors affecting the facial hair removal. Factor number one, sometimes is cost. Factor number two is not an easy procedure. It takes a lot of time. And factor number three is not a painless procedure. It's a real suffering for our patients. But it's clear that if you go to the facial surgery with something like this, your outcome probably is going to be camouflage, is going to be unrealistic, because this secondary aspect, which is so important, is going to hide the reality of the structure. So it's not mandatory, but it's always a very good idea to have treated at least 80% of the facial hair.
And do you have a preference that you tend to recommend that you think works best, electrolysis versus laser?
Well, electrolysis seems to be more effective, but also is painful. So we, in terms of technically talking, we don't mind.
Thank you.
Yep.
We are working with some former clients of ours that have started a company called Peach Clinics in Australia, and they are working on a new design for a machine that is based on the galvanic electrolysis techniques. And because the pain is an issue, they are developing ways of working around that with obviously in painkillers for in intensive sessions. So it's removing hair on a shorter period of time, although the sessions are very intensive. So
Natalia, sorry, Lilia, sorry, I interrupt you.
No, and just using things like Novocaine. So they're working with doctors who are applying painkillers, injectables.
I want to ask Natalia if she agree with our point of view in regards to the facial hair, or do you have a different approach or different thinking?
No, I definitely agree. In general, for me, part of the facial hair removal is part of the social transition, and it's a very important first step. along on par with hormones. And that's something that I recommend for people to get started on as quickly as possible, because as you said, it is painful and it does take a long time. And I do think it's incredibly, incredibly important to offset the outcome of the surgery, because as you said, you look at yourself in a mirror, it will cover and camouflage all of that work you have done. So it's really important. And just in general, people usually start off having a lot of dysphoria about facial hair. And then once they remove the facial hair and they see their face, face free, that's when the dysphoria even more about the face sets in. And usually in my experience, people tend to go for FFS once they have completed probably about 85% of the facial hair removal.
What to me is really magical, let's say, is the mix of the facial hair removal together with the impact of the hormones in the skin. I mean, if you look and you analyze the skin of a man's skin, is so thick, so rude. So I mean, something I wouldn't say naughty, but it's not something pleasant. The skin of our patient, when they come without facial hair and with an adequate hair removal hormonal replacement therapy, is something unbelievable, kind of magical, even more than surgery. So yeah,
I agree, because the hormone, they partially, for the biggest part, take care of your brain, right? Because what happens is that your body finally gets the right hormone that should have been there from the beginning. So psychologically, a lot of your anxiety, depression, and other symptoms tend to go down. So you feel better, you feel like you're in control, and you feel like you're doing something about your transition. And then the facial hair, just having the facial hair gone, I think is a big component for individuals. And Lilia, as you mentioned, we actually do have a really good galvanic method practitioner here in Los Angeles. Alana Zurich is Beverly Hills Hair Free, and she does a galvanic method and offers a lot of time, Novocaine, another type of pain management. But yeah, pain management is one of the biggest reasons why people tend to delay, and it is painful, but boy, you got to get started somewhere, and it's important component of it.
And I think one of the common myths in regards to the hair removal, just to close this topic, is that the intensive sessions of galvanic electrolysis are more expensive. And the thousands of dollars or euros that people spend on laser over the course of years, and then still have to go back and have retouches occasionally, because in some areas the hair is very resistant, where the galvanic intensive sessions of galvanic electrolysis, it may be expensive because it's a shorter period of time. So the same amount of money you would spend on years of laser can be done in a shorter period of time, and that makes it sometimes inaccessible because you have to have a larger lump sum of money up front in order to do this. And what you were saying, moving forward, all of these different secondary aspects, we always talk about these secondary aspects, the soft tissues, the fatty deposits, which happen with HRT, the hair removal. These are all things that are important and in the transition, and it's definitely beneficial if they've been dealt with before FFS. And somebody in the group, Olive, mentioned that when she had her lip lift, it was a problem that she didn't have the hair removal because she couldn't get to the hair because of the scar under her nose, and she regretted not having the hair removed beforehand. So there are many different aspects, advantages to having the hair removal and HRT in advance of FFS surgery. And Dr. Z, you have 2 logs on the topic of HRT. One, not playing doctor, which is important. Although we do say, before FFS, you should have at least 6 months, ideally a year, optimal longer. But if you can, like with seeing someone for psychological support, it's not always accessible for patients to get access to a professional, an endocrinologist or a GP, a family doctor that knows what to prescribe. There are more and more family doctors who are getting on board, but some are still very resistant, saying that, oh no, I can't do that kind of treatment, I don't know anything about it. When really HRT for people in transition it's just like for women in menopause, or for people with thyroid issues. It's just managing the bloods. So we'll put a couple of those links down into our comments, the blogs that you have. The other blog is the 4 biggest lies about starting feminizing HRT. I love that title, Dr. Z. I don't know if you wanted to elaborate a little bit on what you talk about in these blogs.
Yes, absolutely. So the first one that you mentioned, Don't Play Doctor with HRT, discusses the importance of always consulting with your medical provider about your HRT regimen, because going back to dangers of social media, people going to social media and hearing that somebody's taking, this dosage of hormone, or somebody's taking Spiral, or somebody's taking biglutamine, or somebody's taking progesterone, and suddenly everybody's playing doctor and everybody's just kind of, self-administering things to themselves. And the truth is everybody's body is different. It depends how old you are, how your body metabolizes hormone. It depends on many factors, also on if you have any kind of medical condition. So always important to talk about it to your doctor. And the second block that you mentioned talks about a lot of myths and lies out there about feminizing hormones. What is going to be reversible, what's reversible. People have fears about it, that suddenly they're going to start HRT and they're going to have these drastic changes, which doesn't really happen right away. So it's important to be educated and to know. And we're going back to tie to what we started discussing is having realistic expectations. All of this has to do with being an informed consumer. All of this has to do with being knowledgeable individual who goes through all of the stages. And the more knowledgeable and informed you are, the better off you're going to be to make these decisions for yourself.
Absolutely. And on the topic of HRT, we did a live stream with Dr. William Powers a few weeks ago on Facebook, and we'll put the link down in here to that too. He's really opening up the horizons in terms of diversifying the treatments and trying out some different ways, because it's very personalized. In our live stream, that's something that came up, is that just like with FFS, every patient is different, every face is different, every surgical plan is adapted to that particular face. Even though the procedures may be the same, the way the procedure is done isn't always the same. And with HRT, he found that there was a parallel there as well, because each person may need a little more of this, a little less of that, or may not need the blocker, And so it was very personalized, and we thought that personalization of HRT was important. So I encourage you to check the link, and you can watch our live stream with Dr. William Powers, who's a family doctor just outside of Chicago. And we'll be collaborating with him hopefully in the future, and working towards some advancing in the world of HRT for people in transition. You can also see our list of live streams on that post, and we've got some other live streams coming up. And I wanted to make a segue from talking about our live stream with Dr. Powers, and we've seen Dr. Marcy Bowers as well, who's a GCS surgeon, now the psychology specialist here, Dr. Z. So we're trying to bring in different perspectives on transition with our live streams, because we believe that the importance of interdisciplinary collaboration with other professionals will help us advance the trans, non-binary, and intersex and gender non-conforming healthcare. What are both of your thoughts on sharing knowledge within the professional community?
Essential, I would say.
What is it?
Essential. I mean, it's vital. Is the only to me is the only way to advance. To create this network, these links between specialists, sometimes in the same discipline, or the time different specialties, different disciplines, is the only way to provide our patients real excellence treatments and real excellence approach. So to me, I would say vital and basic. I mean, Natalia, what do you think?
I couldn't agree more. I absolutely agree with you. I think that that this kind of interdisciplinary approach is very, very important, because as providers who tailor to gender diverse community, we all work different angles of transition, right? Somebody's working surgical, somebody's working medical, somebody's working psychological, somebody's working social, and so on and so forth. So I think the collaboration and discussion in between is really important, because we can always learn from each other. I mean, that's how I tend to write my blogs when I write them on medical front, because I'm not a medical doctor, is I go to places like you guys where you've done your research, and I look over your blogs where I can get the up to front information. And by sharing that information, we can all be more informed. I can be more informed, so I can help patients better. You can be more informed after talking to me, so you can help patients better. And it's absolutely important, very important.
I am learning so much. Last week, the live stream with 2 different voice training specialists. And one of the first live streams I did in our patient group on Facebook was with 2 specialists in medical pigmentation and the techniques that they use to sort of put the, the final touches on feminization and treat scars, both body and facial scars that they want to improve. It's not a fair deal, if you have a feminization with a visible scar. So you have new beautiful breasts, but the scar needs to be treated. So those are important aspects too. We mentioned earlier before the standards of care, WPATH standards of care, and how it's in its currently revision process, and its 8th edition, and how we're hoping that the changes in this document will increasingly validate the need for training in gender affirming medical professionals. So we have now insurance companies coming on board and offering to cover certain transitional surgeries. But the training programs for these professionals, like we were talking about before, FFS is a very niche area. It's not something that just any surgeon can do. If you have a surgeon who specializes in hand surgery, you wouldn't expect them to come in and feminize your face. And likewise, gender therapy, I imagine there's a parallel as well, no?
Yes, no, absolutely. I think niche, what we call niche, or really people specializing in one area, is important for all multidisciplinaries, whether you're a doctor, whether you're an attorney, I mean, you name it. Specialty is always, always important, because that way you can become as expertly as you can. And I do think that for WPATH, it would be important at some point to start incorporating that for FFS, facial feminization surgeon has to be trained. Working on transgender body is different than working on cisgender body. That doesn't just go for FFS, it goes for breast augmentation, it goes for gender affirming bottom surgery, it goes for all of those procedures. Again, transgender body is going to be different than cisgender body. So the training in the specialty is very, very important.
Yeah, I totally agree, Lilia. I mean, I strongly think, I mean, and I really believe in the ultra specialization. Why? Because, I mean, we are not Leonardo da Vinci anymore. It's a man that can do anything. You can paint well, you can do whatever, and you do it well. We are in a different time now. We have to provide really exceptional outcomes, and to reach this point you need a very solid training behind you. So that is, and I want to ask Natalia, because this is one of my fears now, and when the standard of care and the new standard of care will come out, that probably the insurance company, they are going to offer more and more the possibility of including feminization procedures within their scope. This means that they need providers. How can the patient be sure about the skills and the training and the solid experience of these providers? How your patient deal with that? Is something that they ask, or is something that they don't really care, because at the moment they have the surgery covered by the company, they are happy?
I think there's two sides to this coin. So I think that, first of all, I think that gender diverse community today is becoming much more aware and much more educated. And I think there's more and more people that are out there, they're looking for providers, and they're able to really differentiate between top-notch providers and not top-notch providers. Now, whether they can afford or their insurance will cover top-notch providers is a different matter, but people are becoming incredibly, incredibly educated. And a lot of times, you know, I see patients who will educate me on providers that they're working with. So there's that component. The other component is something that we can't escape unless the medical insurance companies are going to regulate those things. And that is making sure that the doctors, they give the green light to work in trans-surgical field are adequately trained. And that's just something that I think either, I don't know if it's a state issue, if it's medical insurance issue, if it should be something the WPATH should be pushing for, but that's another challenge. And yes, unfortunately, there's going to be patients who won't have any idea whether their surgeon is trained or not. And there's going to be some patients who are going to be very savvy. So again, education is important. I do, Lilia knows I have this post, the first one that connected you and I is, I think it's something to the effect of 11 questions to ask when you're looking for gender affirming providers. And it goes over asking your provider, what is their training? What is their background? How many transgender surgeries they have done? If the provider can't show you any pictures, that's a red flag. If the provider can't tell you how many surgeries they perform, that's a red flag. An adequately trained provider, I'm sure at facial team, if I were to go to facial team for facial feminization, I'm sure there will be pictures you'll be able to show me. I'm sure you'll be able to show me different type of results. I'm sure you would be able to tell me how many surgeries you have performed. So there's all these red flags. We have to educate ourselves to be consumers. But again, sadly, when we're that eager to get the surgery and we're that excited, all of the things go in the back window and we're just, you know, we're just happy to get whoever is out there approved by our insurance. And a lot of people sadly put themselves under knife without doing research.
That's very interesting. To me, one of the main problems here is how recent the discipline is. I said before that the first forehead reconstruction description is from 1987. So it's really, really young. That means that probably you said before, who is going to lead this movement? Is the WPATH, is the institution, is the companies? Probably all of them. I need during the training period of the surgeon, well, or in plastic surgery, or in craniofacial surgery, or in maxillofacial, probably the feminization should be included. You know, probably the companies, they need to ask for a solid background to their providers, the providers. Probably the WPATH, they need to include kind of a seal proving that the surgeon has enough skills to do the surgery. So to me, it's kind of a mixture. So, and I tell you, it's not going to be easy because there is interest conflict and many, but probably this is the way.
Right, it's not going to be easy. I agree with you because there's a lot of layers to it, right? And we touched based on some of them, but it is going to be a challenge because as we, and I think we're kind of reaching the tipping point of transgender phenomenon, where more than ever today we have the language, more than ever today we have the context to understand gender dysphoria. As a result, more and more people are realizing what they're dealing with. This is why we have so many people coming out today, not because suddenly everybody's trans, it's because suddenly people have language to put into meaning what's happening to them. So I think we're going to see even more people coming out. I think we're going to see especially people who are kind of that middle gap that feel like they have a lot to lose and they can't really transition, starting to transition. And as more and more people come out, there's going to be shortage of providers. So there's going to be more surgeons going into the field. And now more than ever, it's important to start regulating that field. Who's going, how is it going trained? And I agree, maybe like a seal of approval that you are certified in this type of surgery. But yeah, until somebody kind of takes it and runs with it and advocates for that, that's going to be a challenge.
But to me, Natalia and Lilia, let's say that this lack of regulation is going totally against our patients. I mean, the patient, the community, because they don't have. I mean, they have to make the choice with no clear arguments. I mean, they have to trust the provider, and sometimes they trust a provider with a clear lack of experience or a clear lack of training, and this is extremely dangerous. So it's something essential to be addressed in probably in the next 5 to 10 years.
Absolutely. I couldn't agree with you more. As a psychologist, there's very few colleagues who specialize in transgender field that I'm aware of in California. What scares me most is that now a lot of mental health providers are becoming what they call LGBTQ friendly therapists. Now, I don't know what that means. I mean, I'm assuming you have to be friendly to anybody you work with because you're therapist. I'm hoping you're going to emphasize these people's diversities, but usually what LGBTQ friendly means is that I have some experience or I'm open to working with gender diverse community. Now that's a big difference between I specialize in it. Because for me personally, because the only clients I take on at this point are gender diverse clients. So as a result, my lens becomes very narrow. So when you walk into the room, I'm like a very niche specialist. I look only at your dysphoria, your state of dysphoria, and I can diagnose you quicker, I can start treatment plan quicker, and I can refer you out quicker. When you go to somebody who's LGBTQ friendly, the lens is very big because they also see a lot of other diagnostic issues, a lot of other clinical issues. So it takes them much longer time to properly diagnose you, to create treatment plan, and to know what to do with you. I mean, I hear that all the time from my clients, all of the time. People come in and say, I've been working with therapists, with gender therapists for a long time, and they haven't even started hormones, when they clearly have been already properly diagnosed with gender dysphoria. Now, I don't know what those providers are waiting for. It's like a slam dunk. It's like medical intervention. You go into medical doctor, you have diagnosis of cancer, to put you on a chemo treatment. The same thing, you go to psychologist to diagnose you have gender dysphoria. Guess what's the next step? Hormones, absolutely, very important. But this is an issue. This is the challenge. Not a lot of people go into specialties. It's not regulated. It needs to be regulated, and it's a big problem.
Absolutely.
Yeah, I say always, Natalia and Lilia, that challenges they empower our motivation, and it is what it is. So we need to continue fighting, and
keep working on it.
Yeah.
Dr. Capitán, someone is asking, and since you're on one of the work groups for the revision of the SOC 8, and they're asking when the SOC 8 will be released. Do you have any insight into that?
Well, I hope. I mean, it's a very confidential, launch, but probably I think they are thinking in the end of 2021 or maybe 22. So approximately.
Yeah, it's not easy. There are lots and lots of professionals working on it, lots of different work groups. So it's a scientific publication, really. So the pandemic probably hasn't helped move it forward.
No, it didn't. It didn't. The group, I mean, the different groups within the standard of care is amazing. How well treated it is. And people is working. I mean, we are doing our part in the phase chapter. Then we have the puberty. Then we have the hormones, the psychotherapy. I mean, I think it's going to be, to me, a keystone in the trans health history. I hope so.
I think it will be very different from the 7th version, which was published in 2014.
Absolutely, yes.
So today we have covered a lot of topics, dangers of social media, expectations, magical thinking, dysphoria, body dysmorphia, rushing to transition, HRT, electrolysis, HRT. I think that it's been pretty comprehensive discussion, and finally now we've talked about the importance of collaborating and establishing the base for healthcare in the community, which we're working on. So it's been some great really great opinions. Thanks to both of you. And now I would just like to know if you have a very specific takeaway message for our viewers here. We've had people from all over the States, East Coast, West Coast, Canada, some people from Europe. So what would you like to leave with our viewers here today, or for the people who come back and watch this video at a future date? Dr. Z?
Sure. I would say this: you, the viewers, whoever is watching today, whoever is going to be watching this replay, you have to start advocating for yourself. If you want to advocate for yourself and your healthcare needs, nobody else will. And it's really, really important for you to take matters into your own hands and to become a very educated consumer. Now, I know there's a lot of garbage out there in media, but then there's a lot of really good written work. There's a lot of studies that Special Team is doing. There's a lot of great blogs that you guys write. There's a lot of information that I put out. There's a lot of other professionals who put out consistently really good, up-to-date information. So becoming really educated consumer and then taking that information and advocating for yourself is important. If you watch Dr. Power's presentation, which is very popular on YouTube about hormone regimens, and you feel like that's something that can benefit you, take that information to your medical provider, educate your medical providers, talk to them, showcase to them. Now, I understand not everybody's going to be receptive, but I think it's kind of an overall work that all of us have to do. We have to specialize and be really good in what we do. And once we're specialized as we are such now, we then need to also advocate for other people to become specialists. We have to advocate for WPAS care, to push for that specialty. And consumers, again, you guys are your biggest advocates. You just got to do it for yourself, and there's nothing wrong with that. You have to demand the best care.
I think that's a very good point. Dr. Capitán, do you have a special message you'd like to leave everyone here listening today?
Yeah, I like very much Natalia's message. So first, I would say love yourself, because probably a lot of people love you. So love yourself, point number one. Point number two, do your research, a very comprehensive research. And point number three, try to look for really solid providers with a good experience on their back during your whole transition journey. Because at the end, you will reach your aim, your objective. And it would be like we see in many of our patients like a dream. So that's my message.
Thank you very much. Please, everybody who's here watching, please give us a hand. Encourage Dr. Z, Dr. Capitán with your clapping in the comments. Thank you both so much for spending the time today to talk with our viewers. Your viewers, now I'm addressing you. Listen, your input and lobbying are important, just like Dr. Z said. So keep talking to us and let us know what you want to hear so we can plan for it in our future live streams. But more importantly, if you're an ally and you're watching this video, a healthcare professional, as I said before, send your messages to your legislators, to your MPs, get your voice out there as well, because we need to support the community. Send those messages out, please, and do what you can to help the charities like GLAAD, like Stonewall, and so many more, that so they may continue their work that is so basic to protecting the human rights of our trans community, like healthcare access and going to the bathroom are respected. Stay tuned, please, for our upcoming lives. Next week, we'll be on Instagram for the first time with the trans athletes, Ella Lakari, who is a goalie in Australia, and Charlie Martin, who is a race car driver from the UK, on June 24th. And I'll also be back here on YouTube with Dr. Helen Weberly and therapist Marianne Oakes of Gender GP, which is a very important online gender clinic. So we'll see them on July 1st.
Lilia.
And here down in the comments, and please click on our invitation to join our private patient group on Facebook, where we'll be putting out reminders about our live streams and also our newsletter if you want to keep up to date with all of our news. And also, sign up for Dr. Z's newsletter to make sure you get notified of her weekly videos and her blogs, which are very, very interesting. And I should say her YouTube channel, which is full of amazing tips and opinions on a wide variety of topics. So thanks again to our viewers, to our speakers today. Stay safe, stay healthy, because your happiness and your healthcare matter. Thank you, everybody. Bye-bye.
Thank you.